Welcome to Dr. Mensch, the radio show that takes a real, compassionate look at mental health from A to Z. Join child and adolescent psychiatrist Dr. Gil Lichtshein each week as we explore topics that matter: autism, ADHD, anxiety, depression, OCD, schizophrenia, behavioral challenges, neurodevelopmental disorders, and more. No stigma, no judgment. Just honest conversations, new therapies, breakthrough treatments, and real solutions for real people. Mental health is not a weakness. It's a treatable medical condition, and help is available. Join the conversation now by calling the studio at 888-994-4995, Studio A. This is Dr. Mensch, where hope and healing begin.
Good afternoon, everybody. This is Dr. Mensch, otherwise known as Dr. Gil Lichtshein. I'm a board-certified child, adolescent, and adult psychiatrist, and I have a private practice office located in Boca Raton at 7100 West Camino Real, Suite 404. My phone number is 561-300-4052. My pseudonym, Dr. Mensch, is kind of a play that Mensch is a Yiddish word that means like a good-hearted, a good, kind person, and it's the title of a book that my book that I co-wrote. The character's name is Dr. Mensch, but kind of a twist of words. The character is not such a nice person, but I'll leave it at that and let for the mystery behind it for people to read the book. On this Thursday afternoon, I'd like to talk about antidepressant medications. It's, I wouldn't say a controversial topic, but especially the use of antidepressant medication in kids is always like a hotly debated issue because of using psychotropic medications in young children. And what we do know is that antidepressants is kind of a generic term to explain medications that are used to treat depression, but the antidepressants that are out there that are commercially available for prescription use actually encompass various different classes of medication and based on how they work. And so, for example, the most common class of antidepressants are called the SSRIs, or specific serotonin reuptake inhibitors. Other classes include SNRIs, or serotonin norepinephrine reuptake inhibitors. There are dopamine reuptake inhibitors such as bupropion, also known as Wellbutrin, and other types of antidepressants that really kind of are in a class by themselves, such as the NMDA receptor antagonist Auvelity, which is a combination of bupropion and dextromethorphan, and there are other antidepressants as well. But when I prescribe them, I kind of don't like to call them antidepressants because a lot of these medications also have anti-anxiety properties and have uses outside of even depression and anxiety. But nonetheless, I'll kind of lump all these medicines or drugs under this kind of generic rubric of antidepressants. Now, in today's world, today's world of just more stress, just more complicated, complex, intricate world that we live in, rates of depression have increased, and they've even increased in children. And the thought is that young kids can't get depressed is kind of not really accurate. Depression does exist even in pre-pubertal school-age children, but certainly the rates, the incidence and prevalence increase as we get older. But nonetheless, if you have a younger child that has severe depression, you often have to resort to using antidepressants. Now, when I was in medical school, we were taught that, I don't want to say depression was a chemical imbalance, and I think that's a very much oversimplification of depression, because depression is a real illness, no different than diabetes, high blood pressure, seizures, or or high cholesterol. Yes, there are no tests, there's no blood test to determine if you're depressed or have depression, unlike, say, diabetes or high cholesterol. But there are now kind of higher tech brain scans called functional neuroimaging scans, such as PET scans and functional MRIs, that actually show that depression is a real functional brain disorder. Unfortunately, these techniques are very expensive and aren't used as diagnostic purposes, and are used more in academia and research. But nonetheless, they actually can show that depression is a functional brain disorder, and even actually can cause some neurodegenerative changes in certain parts of the brain. So that depression in that respect is no different than any other medical problems. And just as epilepsy, diabetes, hyper or hypothyroidism, coronary artery disease can be treated with medication, so can major depression. Nonetheless, again, when it comes to depressive disorders, there's still kind of skeptics out there that kind of look at it differently, even though in some ways major depression can be more debilitating than, let's say, hypertension or hyperthyroidism or diabetes. Now, depression being a medical condition can be treated with medication. There is no cure, but antidepressants, the different type of antidepressants out there, are effective treatment for depression. Now, what kind of makes these different antidepressants unique or different from each other is by their mechanism of action or how they work. So SSRIs, serotonin reuptake inhibitors, as the name implies, they block the reuptake of serotonin and therefore increase levels of serotonin in between the nerve cells and allows for serotonin to bind to its receptor. Other antidepressants can modulate or adjust the levels of other neurochemicals such as norepinephrine, glutamate, GABA, and so the idea that depression is some sort of chemical imbalance, if a patient asks me that, I'll say, yeah, it's kind of an oversimplified explanation, but depression is really much more intricate than simply too little serotonin, too much serotonin, too little dopamine, or too much dopamine. Because in fact, if you are prescribed, let's say, fluoxetine, which is an SSRI, after a few days, serotonin levels will be increased. If you did a lumbar puncture and try to measure levels of serotonin, you'll see that serotonin levels are increased, but you don't see the clinical effects of the medicine in 2 or 3 days. It could sometimes take weeks, and the reason being is what I call these medicines have downstream effects that really underlay or explain how they work. And the analogy I give is like a row of dominoes. If you have, let's say, a row of like 100 or 200 dominoes that you've arranged and you knock the first domino, it's going to take a little bit of time for the last domino to fall. So the way I look at antidepressants, it's like the first domino, and then it's doing its job, and then there's like subsequent dominoes that are falling until the last domino falls, and you start having the clinical effects that could be weeks later. And that how these antidepressants really work is while they're modulating levels of certain neurochemicals, these neurochemicals are then having kind of effects inside the neuron or the nerve cell, and it's causing production of certain what they call neurotropic factors or neuroprotective compounds in the cells that actually help kind of revitalize the cell and kind of increase the functioning of the cell, kind of revitalizing or re-energizing the circuitry. So it's really that impact that where these medications come into play. And what we do know is that after patients are prescribed whatever antidepressants are prescribed, if you did these same type of functional neuroimaging, you'll see changes in brain functioning kind of back to where it was before a patient became depressed. Also, even on certain structural neuroimaging, such as like specialized MRI scans, you could actually see like structural changes in the brain where there's kind of growth of brain tissue or brain cells in certain like areas of the brain that are particularly affected by depression. So kind of try to tell patients that depression is kind of like a neurodegenerative disorder, and I'm not going to say it's like Alzheimer's or frontotemporal degeneration like dementia, where you see kind of widespread like atrophy of the brain, but in depression it's kind of more specific, like particular areas. For example, one area in the temporal lobe called the hippocampus that's particularly affected by depression, where you'll see kind of neuroanatomical changes that antidepressants kind of reverse. So I kind of would say, like, major depression might have the same effects on the brain as Alzheimer's, but on a more localized level, that it has neurodegenerative effects, but much more localized, whereas dementia is kind of broader. It's kind of like the same analogy of an F5 tornado and a Category 5 hurricane. They may have similar wind speeds, but a hurricane is kind of much more broader. A tornado tends to be more kind of isolative or specific. You don't see as much generally widespread damage from a high-end tornado as you would from a hurricane, because a hurricane's a much larger storm. So I would say like dementia is kind of like a hurricane. It has a much more greater structural and functional effects on a particular region of the brain, whereas depression is kind of much more localized, but then the secondary effects of that becomes more apparent, and these medications kind of put these changes kind of to a halt and may actually turn back or reverse some of the damage done by depression. So for that reason, it's always important to start treatment as early as possible. You're kind of doing damage control. And what we do know that, for that matter, most mental disorders, the longer you wait to get treated, sometimes the harder it is to get better and the outcomes get poorer. But again, it's no different than, God forbid, if you had cancer and you waited, and then by the time you got the treatment, you're in stage 3 or stage 4, the outcome, the success of treatment might not be as positive as if, let's say, you kind of nipped it in the bud, and say the first moment you saw certain symptoms, you went to the doctor and they discovered, okay, you have stage 1 or stage 2 cancer, where the prognosis is a lot better. So with that being said, explaining depression and its like mechanism and what it is more intricate and complicated. And so for that reason, I often will tell patients who, unless they're scientists or themselves physicians, may not really understand when I try to explain to them, well, fluoxetine does this and does that, and it causes, upregulation of this and downregulation of that. They're going to look at me like I have 10 heads. So when they say it's a chemical imbalance, I kind of will agree with them and say, yeah, it's a oversimplification, but an easy way to describe it. I will continue with this discussion after a brief commercial break.
What happens when the mind of a healer crosses over into the darkness of the human soul? From authors David Lacavetti, Dr. Gil Lichtshein, and Yolanda De Luca comes a chilling psychological thriller, Dr. Mensch, A Prescription for Evil. This gripping novel follows a respected Boca Raton psychiatrist who secretly descends into madness, transforming into a modern-day king of the underworld. Inspired by true events and Dr. Gil's childhood connection to a mob family, this story blurs the line between sanity and evil, genius and destruction. Unforgettable, disturbing, impossible to put down. Get your copy today on Amazon.com. Dr. Mensch, A Prescription for Evil, a 2020 psychological crime thriller.
You're listening to Dr. Mensch with child and adolescent psychiatrist Dr. Gil Lichtshein. For a copy of his powerful new book, Dr. Mensch's Prescription for Evil, visit Amazon.com. For more information or to schedule a consultation, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. Now, let's get back to the show.
Welcome back. This is Dr. Gil Lichtshein, aka Dr. Mensch. I'm going to be talking about antidepressant medications, the pros and cons, and trying to give an explanation of how they work. And I was saying before that antidepressants work, or its effects and how it works, is much more intricate and complicated than simply, oh, it's correcting a chemical imbalance. And I would say that maybe at the surface level, yes, it's correcting a chemical imbalance, but really it's the kind of domino effect and the downstream effects where antidepressants really have their true therapeutic effects and benefits. Major depression is a serious and debilitating mental disorder causing a lot of morbidity, great amount of disability. Up to 10% of patients commit suicide. So major depression can carry a great toll and burden on an individual and their families. And so the key thing is that when you start noticing the first early signs of major depression, and again, I reiterate to patients that major depression is not just having a bad day. We all have bad days. That's reality. We had a bad day at work. We had a fight with our boss, our best friend, wife, husband. I don't know, you say your baseball team lost. You're a Toronto Blue Jays fan. You lost a World Series. You're going to have a bad day. But that's not depression. I kind of tell patients, think of major depression as having bad day after bad day after bad day, and you never have any good days. Or like having it's sunny outside and you have a dark rain cloud hanging over you, even though it's sunny everywhere else. And the key thing with depression too is that it's starting to affect your day-to-day functioning. If you had a bad day at work, you might be in a bad mood. You come home, you kind of work it off, and then the next day you're back to the regular self. Depression kind of robs you of who you are. And so if you start noticing these kind of changes, get evaluated, get treatment. If it means taking medication, taking antidepressants is no different than if you were prescribed insulin for diabetes or if you were prescribed Lipitor for high cholesterol. Patients, when I recommend antidepressants, a lot of times they'll start freaking out. Why am I going to take this crazy pill? This is a dangerous drug, and I often will remind patients that there are far more dangerous drugs that are prescribed and even you can get over the counter, such as, say, Tylenol. I tell patients Tylenol can cause liver damage. Antidepressants don't cause liver damage, at least to my knowledge. You have epilepsy and you take seizure pills. Some of these anti-seizure drugs have horrible side effects. I say that antidepressants generally are pretty well tolerated medications as a whole. I'm not saying they have their downsides. Some can cause weight gain. Sometimes they can make you kind of feel kind of blah or emotionless. So again, I'm not discounting side effects. And then there was the whole brouhaha back about 20 years ago with antidepressants causing suicide in children, adolescents, and young adults, and there's still a black box warning on most antidepressants, warning of increased risk of suicidal thoughts in children, adolescents, and young adults. But that black box warning in itself created some issues that in the years after the FDA posted those black box warnings, and this is going back, I think, to like 2004, 2005, prescriptions of antidepressants dropped in children and adolescents, rates of suicide went up. So, and then I also try to explain, especially to parents of younger kids, that these black box warnings were specific for patients with major depression, and that these patients at baseline are already at higher risk for suicide, so that you're already dealing with a higher at-risk population to commit or engage in self-harm behaviors. Now, from my own personal experience in prescribing antidepressants to hundreds of children and adolescents over the years, I've never had anybody ever report or experience increase in suicidal ideation, or even have any or act out any suicidal ideation directly as an outcome of a prescription of an antidepressant. So I validate parents and patients' concerns, but I also try to explain to them that the benefits of these medications also really outweigh any harm that it can cause. I also have told parents that in the years after the black box warning, there were autopsy studies of teenagers who had committed suicide, and that many of these, autopsies revealed that these teenagers who committed suicide had no traces of antidepressants in their blood, and so that to make the automatic association that prescribing an antidepressant leads to a teenager or a child committing suicide has got to be taken with a grain of salt. And I know there were also articles in newspapers and in the news in the years after the black box warning of children being prescribed certain antidepressants and then committing suicide. My response to that would be, well, do we know the whole story and all the details? Were these patients, in fact, having had bipolar disorder or something else going on? And again, from my own experience in prescribing antidepressants to hundreds of children, I've never had anybody report, history or making an attempt of suicide as a direct result of being prescribed an antidepressant. Now, in adults, we have dozens of antidepressants that are FDA approved. In children and adolescents, we're much more limited. I believe there's only 2 that are FDA approved. So I will go with those and at least reassure parents that these escitalopram and fluoxetine are FDA approved, and so or at least can say that the FDA has deemed them safer to use. But I also assure parents that there's ample studies, especially studies that have randomized controlled trials, that show that other antidepressants are also equally safe. And unfortunately, many of the SSRIs will probably not get FDA approval in children, and the reason being is more from a financial issue, that many of the antidepressants in the market now have gone generic. And so the original manufacturer, say for example, of sertraline or Zoloft, Pfizer, Zoloft has been off patent for probably like 15 years. I don't think Pfizer is going to go now and spend tens of millions of dollars in getting 2 or 3 of the necessary randomized controlled trials that the FDA would require to get Zoloft FDA approved to treat major depression, when 99.9% of prescriptions of Zoloft are written for the generic. So for Pfizer, it wouldn't really be cost effective. So we're not going to probably see any of these older drugs get FDA approval just because from a financial perspective. But I could foresee, as newer medications come into the pipeline, newer branded products, that perhaps companies will spend the time and money in doing studies on children to see if any future medications might be get FDA approval in treating major depression. But again, using antidepressants off-label or not having FDA approved use does not mean at all that these medications are dangerous or unsafe. Because again, the FDA is, I view it as, it's not a prescribing agency, it's really a political kind of tool. And so a lot of times they'll give approvals and dose ranges that clinically sometimes don't even make sense. So I always look at certain FDA approvals with a grain of salt. But really, again, the bottom line is, especially with more of the younger population, children and adolescents, I will take whatever evidence-based medicines out there and apply that. So if I see a 10-year-old or a 15-year-old that clearly has major depression, I will not hesitate to recommend antidepressant medications no differently than if it was a 25 or 40-year-old. And again, the fact that less medicines are available that are FDA approved doesn't necessarily mean that you can't use them, and especially if there is enough literature in peer-reviewed journals that show that even certain non-FDA approved medications work. In my opinion, they are safe to use. I'm hoping that this kind of brief talk on antidepressants was educational. If you have anybody out there has any questions about the use of antidepressants, I can be reached at 561-300-4052. This is Dr. Gil Lichtshein, aka Dr. Mensch, and I look forward to further episodes talking about other various mental health topics. Thank you very much, and have a good rest of your day.
Thank you for joining us for Dr. Mensch with Dr. Gil Lichtshein, helping you navigate the world of mental health with clarity and care. If you or someone you love needs support, you're not alone. Treatment works and recovery is possible. To schedule a consultation or discuss non-medication therapies, personalized treatment plans, or psychiatric care, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. You can catch us each week on South Florida Oldies Radio and streaming across all social platforms. Until next time.